Hi, my name is Michael Acevedo. I'll be performing the trach care for my patient today. I have my supplies here already, my clean gloves, and my patient here as well. First, we're going to go ahead and wash my hands. After washing my hands, I'm going to go ahead and explain to the patient that we'll be performing care today to his trach. We're going to assist him to a high Fowler's position. We're also going to suction as needed. And now we're going to go ahead and open up our trach care kit. So I'm going to go ahead and remove my sterile gloves, get the drape for our sterile items. Now we're going to go ahead and dump the contents of our trach care kit onto the sterile field. Now we're going to go ahead and get hydrogen peroxide and normal saline. We're going to do a 50-50 ratio for the hydrogen peroxide and normal saline in the top big container compartment. And on the lower two smaller compartments, we're going to go ahead and put normal saline in there. We'll put those away. Once we do that, now we can go ahead and apply our clean gloves. I'm going to go ahead and remove the oxygen source from our patient. We're going to go ahead and unlock and remove the inner cannula. And then we're going to move it out towards us and keeping it the curve of the trach. Then we're going to go ahead and drop the inner cannula into the mixture. Once we do that, we're going to go ahead and let it soak. After that, we're going to go ahead and remove the gauze from around the trach. Go ahead and throw that away. Once we do that, we're going to go ahead and remove my clean gloves and discard all my trash. Now we're going to go ahead and apply my sterile gloves, but before that I'm going to go ahead and perform hand hygiene again. Okay, now that I performed hand hygiene, I'm going to go ahead and open up my sterile gloves. This is sterile and then I go ahead and pull the tabs out. Okay. My non-dominant hand, I'm going to go ahead and pick the glove up and then insert my right hand into the glove. Next, I'm going to go ahead and pick up from the inner cuff of my other sterile glove. Go ahead and apply this one on. Now that we have our sterile gloves on, we don't want to drop it below our waist. We're going to go ahead and take our sterile glove holder and go ahead and remove this. Now, one hand's going to be my sterile hand and the other hand's going to be my dirty hand. So First, I'm going to go ahead and arrange my sterile items in my sterile field. I'm going to go ahead and actually soak my Q-tips in the normal saline. Have it soaking there. Now I'm going to go ahead and get the pipe cleaner and go ahead and clean around and inside of the inner cannula. I'm going to go ahead with my non-dominant hand, and then now this is going to be dirty, my dirty hand. So I'm going to go ahead and get this, clean the cannula, then inside. Then I'm going to go ahead and move that there. Now we can go ahead and replace the inner cannula back into the patient's trach site. Of course, we want to follow the curvature of the trach. So we're going to go ahead and go in. Now that we have done that, next we're going to go ahead and, still with your sterile hand, grab the Q-tip that was soaking in the normal saline, grab it here, go ahead and clean around the site. Throw that away. Grab another one, clean again, throw that away, clean again, away, clean again. Oh. That way. Now I'm going to go ahead and get some gauze and dry around the patient's areas of the trach. Pretty much the sterile process is over because the most sterile part was the inner cannula. Now we're just, maintaining outside of the area. Now we're going to go ahead and change the not cord, trach string around the neck. We want to make sure that we don't dislodge the trach. Just be gentle. Sometimes if the patient is alert and oriented, they can assist us with holding the trach in place. Usually we would like to have 2 nurses here at the same time doing this process, so we can help, especially for a patient who's not alert and oriented. Like I said, just so we won't dislodge the trach. Next, I'm going to go ahead and take the new holder and go ahead and fish this. Once we have that through, go ahead and secure this. Want to go ahead and double knot it if we could. Now that we got that done, now we can go to the other end and go ahead and secure it around the patient's neck. Want to make sure that it's not too tight. And I want to go ahead and secure it. Now that we have it nice and secure, we're going to go ahead and get our T-gauze and replace that with underneath our site. We still want to be careful, especially around here, because it can pop out at any time if the patient accidentally coughs or anything like that. Go ahead and do that. Now we have that there. Next, we want to go ahead and add padding to the patient's neck area. Go ahead and get our new one. Just pretend this is a new one. Then I'm going to go ahead and secure it around the patient's neck so that it doesn't cause any skin breakdown. Go ahead and wrap it. Once I did that, I'm going to go ahead and get my tape. We're not going to tape to the patient's neck, we're just going to tape the gauze that we have around. Now that we have that, we're going to go ahead and apply our oxygen source to the patient, raise the head of the bed to a lower position or more comfortable position. We want to lower the bed to the lowest height as well. down. Now I'm going to go ahead and remove my sterile gloves. Go ahead and discard that. Go ahead and perform hand hygiene. Put the call light in reach for the patient. Let him know if he has any questions or concerns, so please call us if he needs anything. And then I'm going to go ahead and that's it. Remove our trash and everything.